Namaste. Thank you very much, Banshi. Thank you to anyone here on the dais, everyone organizing this Congress for a long-standing, over years ongoing cooperation, passionate, enthusiastic cooperation to improve the quality of diabetes care. It's not only a professional cooperation, it turned into a friendship and turned into a long-lasting friendship. And someone said, an honorable citizenship of India. So it's an honor to be in Indian. And thank you very much to you for being here. As president of IDF, I always try to put the finger in the wound of unmet needs, on gaps we have in diabetes care, on gaps we have in the global care for people living with chronic diseases. And if you're honest, it's vaccination. And I just had this situation outside of this hall. I was talking with some people about shingles vaccination. Then someone came and said, Peter, shingles is not important. Let's make a pick. So, and somehow this represents our perception. Yeah, we might say influenza vaccination. Oh yeah, it's important. Maybe some other vaccination, pneumococcal vaccination is also important. But if you talk about shingles, it's gone. If you talk about other vaccination, it's gone. We don't think it's important. And it's also much more expensive than the other drugs. But if you are honest, if you think about 1,000 people living with diabetes in your practice, 5 of them who do not have diabetes will get shingles. 15 who have diabetes will get shingles. And 3 of the 15 will have severe zoster pain because of shingles. So if they are not vaccinated, they have pain comparable to delivery pain. And this is very difficult to know and not to act. And I want to rush in the next minutes through this. So adult vaccination in people living with diabetes is something we have to address. But to summarize the talk, just in case if I don't need the time, if you have diabetes and you're not vaccinated, you have a much higher risk to get an infection. If you are not vaccinated, you also have a higher risk of getting vaccination, but it's tripling if you have diabetes. And if you have diabetes and you get shingles, you have a much higher risk to have severe pain with it. And all 3, this for me is an argument to vaccinate. So the International Diabetes Federation is very clear that we have to accept that people living with diabetes have a higher risk and we have to vaccinate. We have to address several facets. One is aging. One is aging with diabetes. And one is aging with diabetes in people who were not vaccinated in the past. And I learned that only in 1976, a national vaccination campaign started. So there are people who are above 47 years of age. They are not vaccinated, or they have a very low threshold of vaccination. 47 years of age is not old. Yeah? If you have many people who are 50, 60, the chance that they are not vaccinated is high. If you are not thinking about this, this is something we have to change. Here you look into the trends, aging Indian population. India is getting older and older and older. And as older the people gain, there is an immunosenescence. So the people are somehow immunocompromised due to age. And this again is 4 times higher in people who have also diabetes. So the aging, the comorbidities, and the growing threat to vaccine-preventable disease is something we have to address. Here again, you see after the end of adulthood, we could say this is not a big challenge for us, everything is fine, but then the risk of vaccine-preventable disease increases dramatically because the people alone because of age are immunocompromised. So again, we are talking about the population above the age of 47 years of age because they never had a chance in India by national programs to get vaccinated. So accepting that the aging Indian population is running into a threat due to vaccine-preventable disease. And this will pay off in higher mortality, in higher morbidity, loss of independence, loss of quality of life, everything what we should improve for people living with a chronic disease and especially diabetes. So vaccine preventable disease, VPD, we might accept this influenza, we might accept this pneumococcal disease, maybe also diphtheria, tetanus, pertussis. But if you're talking about shingles, because it's also 10 times more expensive than doing the influenza vaccination, it's something we have to improve. The complexity of aging in people with diabetes or aging with diabetes has multiple facets to affect our immune system. If you look at this slide, it's what is with the thymic involution, what is with the progenitor cells, what is with the release of interleukins, and all this plays together synergistically to reduce the effect of defend in infection. So if you go deeper into it, if you have diabetes, the risk is increased, but also already in the case of pre-diabetes. And this people, 243 million people living with diabetes and pre-diabetes in India, it's the country with the highest number of people living with diabetes worldwide. And we must say every third person in India somehow is affected by diabetes or pre-diabetes in your family. So every one of you knows someone having pre-diabetes or diabetes, except from your patients, and discussing with them about the need of vaccination, not only shingles, all other vaccinations as well, is important. And I mentioned already, and here you see the number 1.5 to up to 4-fold is a risk of getting affected by an infection due to the loss of vaccination, a preventable infection. And I think it's our ethical obligation, if we are able to prevent the infection and not doing it, there's somehow a failure of our ethical challenge as a physician. And we have a very good examples. Think about COVID. Yeah? The COVID pandemic showed us that the AT2 receptor was the entry door of the virus into the cell. And by having an insulin resistance, even if you are treated as people with type 2 diabetes, by having an insulin resistance, this door was widely open, up to 8 times higher risk of getting the cells infected with the COVID virus, up to a 4-fold higher risk of getting the disease, and up to a 3-fold higher risk of getting a severe threat by the disease. You see here, if you had an A1C above 7, 3-fold increased risk of getting a COVID-related hospitalization, and also a 3 times higher risk of getting a severe kind of COVID disease. So this is an example. It's only 5 years away that we had to deal with this. And the response to COVID vaccination here in India was very, very good. There were countries in Europe, other countries with a much lower response to the vaccination. India was one of the frontier. So we have to accept the vaccination against infections. We have to better understand the risk associated for our patient, because we don't often accept this and our patients don't understand. But if we inform them, they might follow. If you go to shingles, there are various risks why the shingles risk is increased. But for me, I would say the driving force why we should vaccinate our patients is if you have 1,000 people in your practice, 5 of them will get shingles. If you have 1,000 people with diabetes, 15 will get shingles, and 3 out of them will have a severe post-herpetic zoster neuralgia. So they will have pain. And here again, these are the numbers I just have shown you. What is the range? 9.4 to 15% or 15 out of 1,000 people will be affected. And this is a high number. And here you see the relation into age. And all the people above 50, I would strongly motivate you to think about the vaccination. This is also what is the recommendation. And 47 years old are those people who had a chance in India to participate in a campaign. So all those who are older did not have this chance. So take home that people with type 2 diabetes have a clearly increased risk of persistent zoster pain. And if they have this persistent zoster pain, they will ask us, why have you not given me 2 shots which prevent the disease lifelong for me? Influenza, you have to give every year. Zoster vaccination is twice after 2 months, and then it's keeping you lifelong safe in reducing the zoster-related pains and shingles infection. So let's jump ahead to keep the time. There are studies showing the efficacy, and it also has a clear effect of the hospitalization due to herpes zoster in people with diabetes if they are vaccinated compared to those who are not vaccinated, another argument. And also the recurrence of the herpes zoster is strongly reduced if we vaccinate our people living with diabetes. So defining the need, there are barriers. The barriers are mostly in our clinical inertia to vaccination as physician, but they are also in a low literacy on our patient side about vaccination, about shingles and zoster. This is something we have to break through. And here you see the people, adults over 47 years of age, are likely to have missed childhood vaccination. So these are the people sitting in your office. These are the people who are now 50 years of age and who never had a chance or very rarely had a chance to get vaccination. What can we gain? There's an expert consensus group here in India who was very clearly, think about healthy patients with comorbidity, especially diabetes, COPD, immunocompromised patient, and also us as healthcare workers. So I don't want to ask whom of you has got 2 shingles shot in the past. So targeted vaccination, I just mentioned the group of people who should get vaccinated, and those with diabetes actually have a very good response as well. Often we see in people living with diabetes, if you vaccinate them, they have a lower response to the vaccine. It's not the case if you do the zoster vaccination. And this was tested in several studies. Here, a long-term efficacy study. And you see in all the age group, there's a very efficient response to the vaccine, so that the people are seropositive. And they're also seropositive if they had chickenpox during the lifetime. And if they have an immune answer, you see the data here, it is doesn't matter what age group, the rate is very high. And here is the study testing in different age group the immune answer to the vaccination. And you see 85% of the people have a sufficient answer or vaccine response in this age group. So it's safe, it's worth, it's efficient, and it's needed to do this vaccination. And finally, how to do it? You start, you wait 2 months, you do it again, and you have a lifelong security. This is maybe not true what I just have said. It's tested for 20 years. So it's calculated if you are 50 and you have a life expectancy of 70 years, you are lifelong safe. There's a high probability that it's also much longer, but this is not tested for it, but we can assume 20 years safety not to get infected. So you can combine it with everything which is on the slide here. So do it, because it's of benefit to our patient. What is recommended in older adults here in India, if you are 65 years and older, you see the list, what is recommended. Especially if you are down the last time, if you're talking about zoster, it's above the age of 50. So this is the group who is, didn't have the chance to have a vaccination during their childhood. And again, these are the other vaccine preventable disease recommendation in older adults. The global organization, unfortunately, IDF is not on this list because IDF does not have a guideline for vaccination. but I'm very sure that will come in the future. We're just in the discussion whether in the next months we should start such a group. But you have strong recommendation from ADA, ASD, and from all the Indian organization. And these are the recommendations from India, from different Indian organizations about vaccination. And here is the RSSDI recommendation about zoster vaccination in diabetes patients. All the people above 50 years of age, they should get the vaccination because the vaccination is always superior in terms of quality of life, in terms of morbidity and mortality of the patient. And you see what products are available. And this is, again, RSSDI and the recommendation, what is the whole map of vaccination recommendations here in India. And you see the shingles, zoster, at the age of above 50, you should do the vaccination. I understand that the patient might say no, because it's 10 times more expensive for the shot than influenza. But we accept influenza, but we have to do it every year. And with 2 shots of the zoster vaccination, you have a lifelong safety. So what is the take-home message? The International Diabetes Federation is very clearly that we should have in mind that people with diabetes, they have a higher risk of vaccine-preventable disease. And the way to prevent this is vaccination, vaccination, vaccination. And we are clearly into it, including herpes zoster, that you should do this. And let me finish again. Why IDF? There are 3 goals: brain of the politician, pocket of the patient, and heart of the healthcare professional. I want to go ahead as president of IDF. We will test the quality of diabetes care, including the rate of vaccination in people living with diabetes once a year, make an index to build a momentum for improving quality of diabetes care. We will use digitalization in the pocket of the patient to improve quality of care. And all of you are invited to become fellow of the International Diabetes Federation. Let's work together to finally improve the quality of life of people living with diabetes and help our patients, including vaccination against zoster, to walk away from diabetes. Thank you very much. Dhanyavad.
Thank you, Pinta.